Picture this scene under a silvery moon in the year 1300 and something. In a quiet forest clearing, a lone figure moves silently among the shadows, their hands carefully selecting leaves and roots by the faint lunar glow. There are no flashlights, no smartphones, no modern conveniences, just the ancient knowledge passed down through generations. This herbalist knows that with winter approaching and sickness lurking in every village, these plants might mean the difference between life and death for an entire community. In their world, a simple fever could be a death sentence, a cough could signal the end, and every remedy came not from a laboratory but from the earth itself. We live in an age of incredible medical advancements, hospitals with cutting-edge technology, pharmacies stocked with countless remedies, doctors who can diagnose conditions with precision unimaginable just a century ago. But travel back with me 700 years, to a time when medicine was both an art and a mystery, when healers relied on intuition, tradition, and the hidden power of plants. In the 1300s, life was fragile. Without antibiotics, without vaccines, without even a basic understanding of germs, people turned to those who claimed to understand nature's secrets, the herbalists. These practitioners weren't just gatherers of plants. They were guardians of hope in a world where illness struck without warning and recovery was never guaranteed. What could these medieval healers actually cure? What astonishing claims did they make, and how much of their knowledge was lost to time? In this video, we're stepping into their shoes, walking through those moonlit forests, exploring the handwritten recipe books, and uncovering the remarkable stories of what herbalists in the 1300s believed they could heal. From love potions to plague remedies, from sleep elixirs to salves for battle wounds, we'll reveal the astonishing breadth of medieval herbal medicine and separate myth from reality. This is more than a history lesson. It's a journey into a world where every leaf, root, and flower held the promise of survival, and where the line between science and superstition was often blurred. So settle in, open your mind, and let's explore together the captivating, mysterious, and sometimes shocking world of medieval herbalism. Now, while our moonlight herbalists knew the land, their true workshop was not just the forest but the apothecaries' chamber. This was a place of fascinating contrasts, part kitchen, part laboratory, part sacred space. It might be a dimly lit room in a monastery, a cluttered corner of a wise woman's cottage, or a market stall in a bustling town. Here, the raw gifts of nature were transformed into potent medicines using a toolkit that was both simple and surprisingly sophisticated for its time. The most iconic tool, of course, was the mortar and pestle. Carved from heavy stone or hardy wood, this indispensable duo was used to grind dried roots, crush seeds, and pulverize brittle leaves into fine powders, releasing their vital essences and making them ready for blending. But their equipment didn't stop there. These healers used sharp iron knives for precise cutting, bronze scales for weighing ingredients to the finest grain, and an array of clay pots, glass vials, and leather pouches for storing their precious concoctions. One of their most advanced techniques was distillation, a process we often associate with much later alchemists. Using an alembic, a clever apparatus made of copper or glass, they could carefully heat plants suspended in water. The steam would rise, travel through a coiled tube called the serpentine, and cool back into a liquid in a separate receiving flask. This allowed them to capture the very soul of a plant, creating what they called quintessences or aqueous spirits, highly concentrated herbal extracts. Imagine the dedication required to distill a single bottle of rose water, requiring countless petals and hours of meticulous, watchful labor. They also mastered the art of infusion, steeping plants in hot water or wine to draw out their properties, much like we make tea today. For preserving remedies or creating salves, they would gently simmer ingredients in animal fats or oils, often beeswax, to create healing balms that could be spread on wounds or sore muscles. Their methods reveal a deep, practical understanding of chemistry, even if they explain the results through the lens of humoral theory or spiritual virtue. This wasn't just haphazard mixing, it was a deliberate, thoughtful craft. To truly grasp why an herbalist reached for peppermint instead of poppy, or prescribed sage over saffron, we must step inside their worldview. The entire medical universe of the 1400s, and for centuries before, revolved around a single, powerful idea: the theory of the four humors. This wasn't just a medical concept, it was a complete philosophy of health, personality, and our very place in the natural world, inherited from the ancient Greeks like Hippocrates and Galen, and still utterly dominant 700 years ago. According to this doctrine, the human body contained four vital fluids, or humors: blood, phlegm, yellow bile, and black bile. Your health was determined by the precise balance of these four substances. An excess or deficiency of any one humor was believed to be the root cause of all illness, from a common cold to a raging fever. But the humors were about much more than just physical health. They were also thought to define your entire temperament and personality. A person with a predominance of blood was considered sanguine, naturally cheerful, passionate, and active. Someone with too much phlegm was phlegmatic, calm, unemotional, and sometimes sluggish. An excess of yellow bile created a choleric temperament, easily angered, ambitious, and impulsive. And an abundance of black bile led to a melancholic state, prone to sadness, introspection, and creative genius. This system created a fascinating link between a person's physical health and their mental and emotional state, something modern medicine is only recently beginning to explore again. So how did an herbalist use a garden to fix a humor that was out of balance? It all came down to the qualities they believed were inherent in every single plant. They saw the world and everything in it as a combination of four primary qualities: hot, cold, wet, and dry. Each humor was associated with two of these qualities. Blood was hot and wet, phlegm was cold and wet, yellow bile was hot and dry, black bile was cold and dry. Illness was essentially an imbalance of these qualities, perhaps an overwhelming damp cold from too much phlegm, or a dangerous, feverish heat from an excess of yellow bile. The herbalist's job was to fight like with like, or more often, to fight with opposites. If a patient was suffering from a fever, a clear case of a hot and dry imbalance, the healer would search for plants classified as cold and moist to cool them down. They might prescribe cucumbers, lettuce, or violets. For an illness marked by chills and congestion, a classic cold and wet condition, they would turn to hot and dry herbs to provide warmth and dryness, like ginger, pepper, or garlic. This intricate system of classification meant that every single plant in their repertoire had a defined role. There were no general-purpose medicines. Every remedy was a targeted tool designed to shift the body's internal climate back toward a perfect, harmonious equilibrium. This fundamental belief that plants could manipulate the body's core qualities was the unwavering principle behind every single treatment they prepared. Armed with this deep belief in balancing humors, the medieval herbalist faced one of their most common and terrifying adversaries: fever. In an age before thermometers, a fever wasn't just a symptom. It was the illness itself, a raging, dangerous heat that could consume a person from within. They saw it as a clear and catastrophic excess of the hot and dry qualities, often blaming an overflow of yellow bile. The treatment, therefore, was straightforward in principle though complex in practice. They had to cool the patient down. This is where some of their most effective and enduring remedies come into play, many of which we still recognize today for their genuine medicinal properties. One of their most powerful weapons grew on the banks of streams and in damp meadows: the willow tree. Herbalists would carefully strip the bark, often from younger branches where the concentration of the active ingredient was highest. This bark was then dried and ground into a coarse powder using that heavy stone mortar and pestle. They would then simmer this powder in water or wine for hours, creating a bitter, astringent tea. What they didn't know, but what modern science confirms, is that willow bark contains a compound called salicin. When ingested, our bodies convert salicin into salicylic acid, the foundational chemical ancestor of what we now know as aspirin. This decoction would genuinely reduce inflammation, alleviate pain, and, most importantly, lower that dangerous fever. Their explanation was that the willow, a tree that thrived in cool, wet places, imparted its cold and moist qualities to the patient, directly combating the hot, dry fever. Their reasoning was based on their worldview, but the results were genuinely effective. For less severe fevers or for children, they might turn to a gentler remedy, the delicate, creamy white flowers of the elderberry bush. Elderflower was classified as cold and dry, making it another perfect antagonist for a hot fever. They would gather the entire flower heads, known as umbels, and prepare them as a light infusion, essentially a simple tea steeped in hot water rather than boiled. This light, fragrant tea was a diaphoretic, meaning it encouraged the body to sweat. This sweating process is one of the body's natural mechanisms for cooling itself down and fighting infection. So while the herbalists believed the sweat was expelling the excess heat humorally, they were accurately facilitating a key bodily defense mechanism. They often combined elderflower with peppermint, another cooling herb, to create a refreshing and truly therapeutic drink that soothed patients and helped break fevers. Then there was the condition they called ague, a mysterious illness marked by violent, repeating cycles of bone-chilling cold, followed by drenching sweats and blazing heat. We now recognize this classic pattern as almost certainly malaria, a disease carried by parasites and transmitted by mosquitoes, which would have been rampant near the marshes and stagnant waters common in medieval Europe. To treat this terrifying roller coaster of hot and cold fits, herbalists employed a fascinating plant, yarrow. Known as soldier's woundwort for its ability to staunch bleeding, yarrow was also a key remedy for ague. They would use its feathery leaves and flat-topped clusters of white flowers, preparing it as a strong tea. Yarrow is also a powerful diaphoretic. It could drive a patient to sweat profusely during the hot phase of the fever, which may have helped their body regulate its temperature. Beyond that, yarrow contains a complex cocktail of compounds with antispasmodic and anti-inflammatory properties, which could have eased the muscle aches and pains that accompanied the violent shivering of the chills. Their comprehensive approach didn't stop with internal remedies. They understood the importance of comfort. They would use cool cloths soaked in infusions of lavender or rose water to soothe a fevered brow, and keep patients hydrated with barley water, demonstrating a holistic grasp of care that extended beyond their theoretical framework. While they could not cure the underlying parasitic infection of malaria, their treatments provided real, measurable relief from its debilitating symptoms, making the difference between suffering and comfort, and perhaps even between life and death for a patient whose body was struggling to fight the disease. Yet if fever was a common foe, nothing compared to the sheer existential terror unleashed by the Black Death. This was the herbalists' ultimate trial, a pandemic of apocalyptic proportions that swept across Europe in the mid-1300s, wiping out perhaps half the population. Conventional medicine, rooted in humoral theory, was utterly powerless. Physicians fled cities, and religious explanations of divine punishment offered little comfort. In this vacuum of hope, herbalists became the last line of defense, deploying every piece of knowledge they possessed in a desperate, frantic battle against an invisible, incomprehensible enemy. Their remedies from this period are a fascinating window into human desperation, blending practical observation with pure superstition, and sometimes stumbling upon surprising degrees of effectiveness. One of the most iconic images from the plague years is that of the plague doctor, his beaked mask stuffed with a powerful bouquet of aromatic herbs. This wasn't just a strange costume, it was a direct application of herbal theory. The prevailing belief was that plague spread through miasma through poisoned, foul air. The logical defense, therefore, was to surround oneself with powerfully fragrant plants that could purify the air before it was breathed in. People carried small posies of flowers to sniff when walking through streets, and homes were fumigated with clouds of smoke from burning rosemary, juniper berries, frankincense, and myrrh. While this did nothing to stop the flea-borne Yersinia pestis bacterium, it likely offered a secondary benefit. The strong, pungent smells helped to mask the overwhelming stench of death and decay that hung over afflicted cities, perhaps making the unbearable slightly more tolerable for those still living. Some of the most elaborate concoctions were reserved for the wealthy who could afford exotic ingredients. A famous remedy known as Four Thieves vinegar allegedly allowed a band of grave robbers to loot the dead with immunity. The recipe called for steeping a powerful blend of garlic, rue, sage, lavender, and wormwood in vinegar for weeks. This pungent liquid was then used to wash the hands and body and was even sipped cautiously. While it wouldn't confer immunity, modern science gives this remedy a grudging nod of approval. Garlic has known antimicrobial properties, and the high acidity of the vinegar base could have acted as a half-decent disinfectant for the hands, potentially killing some surface bacteria and offering a minuscule layer of protection against transmission, especially for those handling the sick or the dead. Rue and wormwood, though toxic in large doses, are also potent insect repellents. Applying this vinegar to the skin might have actually helped ward off the fleas that were the true vectors of the disease, creating a crude but possibly effective barrier. For those already stricken, treatments became more extreme. Herbalists would turn to sudorifics, herbs designed to provoke a massive, purifying sweat to drive the poison from the body. The most famous of these was the rare and expensive spice, saffron, often mixed with other heating agents like ginger and pepper. The goal was to radically overheat the patient to burn out the disease. Another common, yet terrifying, practice was the use of thuriac. This wasn't a single plant but an immensely complex mixture that could contain dozens of ingredients, including opium for pain, viper's flesh, which was thought to be an antidote to poison, and various spices. It was believed to be a universal antidote, a cure-all of last resort. Its effectiveness was likely due mostly to the opium, which could at least ease the agonizing end for a victim suffering from the painful buboes. Perhaps the most startling prescription, one that highlights the depth of their desperation, was the use of deadly poisons itself. Some herbalists advocated for very small, carefully measured doses of plants like henbane or belladonna. These are powerful anticholinergics, which means they can dry up bodily secretions. In a patient suffering from the pneumonic form of the plague, which fills the lungs with fluid, a tiny dose might have slightly reduced those secretions, offering a brief easing of the drowning sensation that accompanied that particular form of the disease. It was an incredibly dangerous gamble, balancing on a knife's edge between a fraction of relief and accelerating death. This practice reveals a keen, if imperfect, observation that sometimes a dangerous substance could produce a powerful physiological change. In the face of certain gruesome death, the calculated risk of poison must have seemed a reasonable bet. These herbalists, armed with their mortars and their ancient texts, were not fools. They were intelligent people applying a flawed system to an unprecedented catastrophe, and in their struggle, they occasionally found slivers of genuine relief hidden within the layers of superstition and hope. While the plague represented a battle on a massive, invisible scale, the medieval herbalist's skill was just as vital in treating the brutal, physical realities of everyday life. In a world of manual labor, constant warfare, and sharp tools, wounds were a common and deadly threat. A simple cut from a scythe, a deep gash from a blacksmith's hammer, or a soldier's arrow wound could swiftly turn fatal if infection set in. Without any concept of bacteria, these healers operated on a different principle, that wounds needed to be cleaned, closed, and protected from corrupting outside influences, which they often called poisons or pestilential air. Their methods, guided by centuries of observation, were remarkably effective, and many of their chosen remedies are now proven by modern science to be powerful. Antimicrobial, one of their most prized and potent weapons, was something we still keep in our pantries today: honey. Herbalists would seek out thick, dark honey, often harvested from wild bees, and apply it directly to open wounds and ulcers. They would carefully spread a layer over the injury before wrapping it with a clean linen bandage. Their reasoning was that the honey's thick, sweet nature would seal the wound from the corrupting air and draw out any lingering impurities. What they couldn't see was that they were creating a near-perfect natural bandage. Honey is intensely hygroscopic, meaning it pulls moisture out of its environment. By drawing fluid from the wound, It effectively dehydrates and kills bacteria trying to grow there. Furthermore, when honey reacts with bodily fluids, it slowly produces tiny amounts of hydrogen peroxide, creating a constant, gentle antiseptic release right at the site of the infection. This combination creates a barrier that is not only antibacterial, but also promotes healing and reduces scarring. They were using one of the world's oldest and most effective antibiotics. For stopping the frightening flow of blood from a fresh wound, they turned to astringent plants, herbs rich in tannins that cause tissues to constrict and contract. The most famous of these was undoubtedly yarrow, which earned its common name, soldier's woundwort, on battlefields across Europe. A handful of its fine, feathery leaves would be crushed directly into the wound to staunch the bleeding. The tannins in the plant would prompt the blood vessels to narrow and encourage blood to clot more quickly. Another powerful astringent was the common plantain leaf, often called waybread for its tendency to grow along well-trodden paths. It was a staple of every herbalist's wound kit. The broad, ribbed leaves would be chewed into a pulpy green mass. Saliva was believed to activate its virtues, and then packed into the cut. This poultice would not only help stop bleeding, but also soothe the pain and reduce swelling. We now know plantain has anti-inflammatory and mild antimicrobial properties, making this folk remedy a genuine multi-purpose first aid treatment. Perhaps no plant was more synonymous with protection against infection than garlic. Its pungent, sulfurous odor was believed to have the power to drive away evil spirits and pestilence alike. Herbalists would crush cloves of garlic and mix them with grease or oil to create salves for applying to wounds, or they might hang braids of it in sick rooms to purify the air. While they attributed its power to its hot and dry qualities, we now understand that allicin, the compound released when garlic is crushed, is a broad-spectrum antimicrobial agent. A garlic poultice applied to a wound would have actively fought against a wide range of bacteria, significantly reducing the chance of a dangerous infection taking hold. Similarly, they used herbs like thyme and sage, both powerful antiseptics in their own right, in washes to clean wounds before dressing them. They would steep these herbs in hot water or vinegar to create a cleansing solution, intuitively using the acidity of vinegar or the antimicrobial oils in the plants to disinfect the injured area. Their methods were a blend of keen observation and inherited wisdom, a practical science that delivered real results long before anyone could explain the microscopic world they were so effectively combating. Beyond the dramatic battles against plague and infection, the medieval herbalists' practice was deeply rooted in solving the far more common, yet equally distressing, struggles of daily life. Few ailments were more frequent or disruptive than those of the gut. In an era where food preservation was uncertain, water purity was a constant gamble, and diets were often monotonous and coarse, digestive complaints were a universal burden. The discomfort of a sour stomach, the debilitating pain of constipation, or the life-threatening weakness brought on by relentless diarrhea were all too familiar. Just as with fever, the herbalist approached these issues through the lens of humoral balance, viewing the digestive system as a delicate cooking pot that required just the right amount of heat and moisture to function properly. When this internal furnace burned too low, producing a cold and sluggish digestion, the result was often constipation and painful bloating. This was seen as an excess of the cold and dry qualities, much like the melancholic humor of black bile. To rekindle this digestive fire, herbalists turned to stimulating laxatives and carminatives, herbs that would provide warmth and movement. One of their most trusted remedies was senna, a powerful purgative imported from warmer climates. The dried pods and leaves were ground and infused into a bitter tea. Acting as a potent stimulant laxative, senna irritates the lining of the bowels, triggering strong muscular contractions that force matter along. The herbalist interpreted this dramatic effect as the herb's intense hot and dry qualities successfully overpowering the stubborn cold and dry blockage, heating and drying the stagnant matter to push it through. They understood its strength, however, and often combined it with milder herbs like ginger or fennel to moderate its harsh action and ease the accompanying cramping. For a more gentle, tonic approach to a sluggish gut, they might prescribe rhubarb root. Unlike the culinary stock we eat today, the medicinal root was prized for its unique dual nature. In smaller doses, it acts as a bitter tonic, stimulating the appetite and encouraging the body's own digestive secretions. In larger doses, it becomes a reliable, though milder, laxative. This adaptability made it a versatile tool in the healer's kit, useful for everything from a simple lack of appetite to more severe blockages. Its classification was nuanced. They saw it as possessing a warming quality that could stir digestion, but also a cooling property that could soothe an overheated liver, making it a balancing agent for a wide range of complex digestive complaints. But if constipation represented a system that was too cold and stagnant, its opposite, diarrhea and dysentery, represented a dangerous state of excessive, uncontrollable flow. In the humoral system, this was a classic illness of excess moisture, a failure of the body's ability to retain and process fluids. This was not merely an inconvenience. In a time of widespread malnutrition, chronic diarrhea could lead to fatal dehydration and weakness in a matter of days. The herbalist's goal here was to apply astringents, plants brimming with compounds that cause tissues to tighten, contract, and hold fast. The most common and effective astringents were those rich in tannins, the same compounds that make young wine taste bitter and leave your mouth feeling dry. They would seek out the root bark of the blackberry bush, a plant growing wild in hedgerows and woodlands. After carefully digging up the roots, they would strip the bark, dry it, and grind it into a powder to be brewed into a strongly astringent tea. This concoction would be administered to literally tan the inflamed and overactive lining of the bowels, causing the tissues to contract and reducing the secretion of fluids, thereby slowing the passage of waste. Its effectiveness is confirmed by modern science. Tannins are indeed powerful astringents that can reduce inflammation and secretion in the mucous membranes. Even more powerful was the bark of the mighty oak tree. Oak bark was considered one of the most strongly binding substances available, a true powerhouse for halting fluxes of all kinds. It was used not just for dysentery, but also for gargling with sore throats, washing bleeding wounds, and treating hemorrhoids. A decoction of oak bark would create an intensely bitter, mouth-puckering brew that acted as a powerful anti-diarrheal. The herbalist saw this as the ultimate application of a dry quality to combat a wet ailment. They believed the oak, as a strong, solid, and enduring tree, imparted its stable, binding virtues to the patient, restoring order and structure to a system that had become far too fluid and chaotic. This approach to gut health reveals a sophisticated, if metaphorically different, understanding of the body's needs. They may have explained it as balancing qualities, but their meticulous observations led them to plants with undeniable physiological effects, providing real relief from some of life's most common and agonizing ailments. But the challenges of medieval life weren't confined to wounds and digestion. They filled the very air people breathe. In cramped, poorly ventilated homes heated by smoky fires, during long, damp winters, and in the dusty environments of fields and workshops, respiratory ailments were a constant plague. A persistent cough could be a source of genuine dread, a sign of everything from a common cold to the deadly consumption, what we now call tuberculosis. For these conditions, the medieval herbalist became a master of the lungs, employing a sophisticated understanding of herbs that could soothe, clear, and heal the respiratory passages, often through methods that feel surprisingly modern. Their approach was nuanced, targeting the specific nature of the cough. A dry, hacking, tickling cough that produced nothing was seen as an irritation, a kind of dryness in the lungs that needed to be moistened and calmed. For this, they turned to demulcent herbs, plants rich in soothing, slippery mucilage that could coat the raw and inflamed throat. The most common remedy was a simple tea made from marshmallow root or leaves. When soaked in cold water, this unassuming plant releases a thick, gelatinous substance that forms a protective film over the mucous membranes, providing immediate relief from that scratching, painful sensation. They might also use common mallow or violet leaves for the same purpose, creating gentle emollient drinks that offered comfort and allowed for restful sleep, which was itself a powerful medicine. A more concerning and dangerous cough was one that was wet and congested, marked by a rattling in the chest and the feeling of being unable to clear thick, stubborn phlegm. This was viewed as an excess of the cold, wet phlegmatic humor bogging down the lungs. Here, the herbalist strategy shifted dramatically from soothing to stimulating. They needed herbs that could act as expectorants, substances that irritate the bronchial passages just enough to trigger a productive cough, effectively helping the body to expel the mucus that was harboring infection. The champion of this category was white horehound. This bitter, woolly-leaved plant was renowned for its powerful ability to loosen congestion. They would brew it into an intensely bitter tea or, more commonly, craft it into a thick syrup by slow simmering the herb in honey or sugar water. This horehound syrup acted as a potent bronchial stimulant. Its harsh taste was a direct signal of its vigorous action, provoking deep, productive coughing fits that ultimately cleared the airways. We now know that compounds called diterpenoids and horehound are responsible for this effective expectorant action, validating 1,000 years of traditional use. For particularly stubborn chest infections, they would bring in heavier reinforcements. Elecampane, a tall plant with bright yellow flowers, was prized for its large, aromatic roots. This was considered a warming, drying herb par excellence, perfect for combating the cold dampness of phlegm. The root was diced, dried, and then slowly decocted for a long time to make a strong medicinal tea. Elecampane contains a compound called inulin, a probiotic fiber, but more importantly for the lungs, it has antiseptic properties and acts as a soothing expectorant. It was particularly valued for chronic, deep-seated coughs and wheezing, making it a key remedy for those suffering from what might have been asthma or chronic bronchitis. Its dual action, soothing the bronchial tubes while simultaneously helping to expel mucus, made it a sophisticated and highly valued part of their respiratory arsenal. Another cornerstone of their practice involved harnessing the power of steam. Herbalists would instruct patients to lean over a bowl of boiling water into which they had tossed handfuls of aromatic, antimicrobial herbs like thyme, rosemary, or sage. They would then drape a towel over their head to create a tent, inhaling the potent, medicated vapor deep into their lungs. This practice of steam inhalation is something doctors still recommend today. The warm, moist air helps to thin thick mucus, making it easier to cough up, while the volatile oils from the herbs like thymol and thyme act as natural antiseptics and decongestants, directly soothing the inflamed airways. This method demonstrates a profound practical understanding of delivering medicine directly to the site of the problem, a primitive but effective form of targeted aerosol therapy. Through these combined methods, soothing syrups, stimulating expectorants, and medicated steam, the medieval herbalist provided genuine, multi-faceted relief for suffering lungs, offering comfort and promoting healing through a blend of keen observation and the potent virtues of plants. Yet while herbalists treated the shared ailments of the community, there existed a separate, deeply guarded realm of healing knowledge, one that was almost exclusively the domain of women. In the 1300s, the world of women's health, from puberty to childbirth and beyond, was considered private, even secretive. Male physicians, guided by the formal texts of Galen and Avicenna, often had shockingly little practical experience with female anatomy and reproduction. Their involvement typically began only when things had gone terribly wrong. Into this intimate and critical space stepped the wise women, the midwives, and the local healers, women who possessed generations of hard-won knowledge about the female body, passed from mother to daughter and practitioner to apprentice, often in whispers and behind closed doors. Theirs was a practice built not on theory, but on necessity and profound observation. One of their most common challenges was regulating the menstrual cycle. A woman's periods were seen as her body's essential method of purging excess blood, a vital process for maintaining humoral balance. When this cycle was absent, a condition known as amenorrhea, it was a cause for serious concern, viewed as a dangerous stagnation that could lead to a buildup of melancholy and all manner of other illnesses. To restart the flow, these healers employed a category of herbs known as emmenagogues. They might prescribe a strong tea made from the leaves of rue, a powerful, bitter herb with a formidable reputation for stimulating uterine contractions. Pennyroyal, a member of the mint family with a sharp, pungent scent, was another common choice, often brewed into a potent infusion. While effective, these herbs were also known to be dangerous in high doses, capable of triggering violent cramping and even miscarriage. Their use required a precise, experienced hand, a knowledge of dosage that was learned through practice and careful mentorship, not from any written text. For excessive or painful menstruation, the opposite approach was needed. Herbs to soothe and moderate. They would turn to lady's mantle, a plant whose delicate, scalloped leaves were thought to resemble a woman's cloak. A tea made from this herb was used to ease severe cramping and reduce heavy bleeding. Its modern scientific analysis reveals the presence of salicylic acid compounds, similar to those in willow bark, providing a genuine anti-inflammatory and pain-relieving effect that would have brought real comfort to suffering women. The pursuit of pregnancy and the fear of infertility were powerful forces in a woman's life, and the wise women held a vast repertoire of fertility aids. Some were based in sympathetic magic, like carrying the root of the phallic-shaped orchid, but many were grounded in plant properties that modern science is only beginning to explore. Chasteberry, for instance, was a key remedy. Despite its name suggesting suppression of desire, it was actually used to regulate the hormonal imbalances that could prevent conception. They would harvest the dark berries of the chaste tree, dry them, and administer them over cycles to help normalize progesterone levels, creating a more favorable environment for pregnancy. Another common prescription was red clover blossoms, steeped into a nourishing tea, rich in vitamins and minerals, and containing compounds called isoflavones that mimic estrogen. This drink was believed to build blood and strengthen the entire reproductive system, preparing a woman's body for the immense task of childbearing. But the wise woman's most critical, most revered role was as a midwife. Childbirth was the battlefield where her skills were truly tested, a time of immense danger where mother and child balanced on a knife's edge. To ease the agonizing pain of labor, they had few options. Opium poppy syrup was a precious and powerful tool, but its use was risky, as it could also slow contractions and sedate the newborn. More commonly, they relied on psychological support, massage, and the gentle encouragement of time-tested traditions. To help speed a slow or stalled labor, they would administer a tea made from blue cohosh root. This powerful herb acts as a uterine stimulant, intensifying the strength and frequency of contractions. It was a gamble, a calculated risk to save a mother from exhaustion and a child from suffocation when labor had dragged on for days. Its counterpart was black cohosh, used not to intensify contractions but to help establish a productive rhythm in a disorganized labor, helping the uterus find its efficient pace. Perhaps their most crucial knowledge lay in stopping the terrifying hemorrhage that could follow birth, the single greatest cause of maternal death. Here, their most trusted ally was the same humble plantain used on battlefields. A strong decoction of plantain root was given to the mother to drink to staunch the internal bleeding, its powerful astringent properties causing blood vessels to contract. Shepherd's purse was another lifesaver. Even a few drops of the juice pressed from this common weed could dramatically reduce postpartum bleeding, a fact that has been validated by modern clinical studies. After the birth, the care continued, to help the uterus contract back to its normal size and to encourage the flow of lochia, the postnatal cleansing process. They would prescribe raspberry leaf tea. This was not just an old wives' tale. Raspberry leaf is rich in fragorine, an alkaloid that tones and tightens pelvic muscles, including the uterus. To promote milk production for nursing, they turned to galactagogues like blessed thistle and fenugreek seeds, herbs still recommended by lactation consultants today for their ability to support a healthy milk supply. This entire branch of medicine was a testament to female resilience and ingenuity. It was a science of survival, practiced in the dim light of a cottage, far from the universities and Latin texts, yet it was every bit as sophisticated, nuanced, and ultimately, as vital as any other healing art of its time. Yet beyond the physical body, the medieval healer understood that some of the most profound suffering occurred within the mind and spirit. In an era where life was often brutal, short, and filled with uncertainty, conditions of profound sadness, paralyzing fear, and spiritual despair were widespread. They did not have our modern vocabulary of depression or anxiety. Instead, they grouped these afflictions under the powerful, evocative umbrella of melancholy. This was not just a fleeting mood but a serious medical and spiritual condition, believed to be caused by a dangerous dominance of black bile, the cold and dry humor. This imbalance was thought to cloud the mind, burden the spirit, and create a heavy, sluggish despair that could completely consume a person. The herbalist's role was to warm and moisten this cold, dry stagnation, to lighten the heart and restore balance to a soul weighed down by the world's darkness. One of their most cherished remedies for a troubled mind was a plant whose soothing fragrance we still appreciate today, lavender. They would harvest the purple flower spikes and use them in a multitude of ways. Lavender was strewn on floors to release its calming scent when walked upon. It was sewn into small pillows to place beside one's head at night to encourage peaceful sleep and ward off nightmares, and it was brewed into a gentle tea to sip during times of agitation. They classified lavender as hot and dry, making it the perfect opponent for the cold, dry nature of melancholy. Its warming quality was believed to gently heat the cold stagnation of black bile, while its renowned fragrance was thought to strengthen the brain and clear away the corrupt vapors causing confusion and despair. Modern science now shows that the essential oil in lavender, particularly linalool, has documented anxiolytic and sedative effects, acting on the brain's neurotransmitter systems to genuinely reduce anxiety and promote relaxation. Their method of using its scent for therapy was a primitive but effective form of aromatherapy, a practice that recognized the deep, direct link between smell and emotional state. For deeper, more entrenched states of sorrow and mental anguish, they turned to a more potent botanical ally, St. John's wort. This plant, with its bright yellow flowers that bloom around the summer solstice, was associated with light and the sun, the natural antagonists to the darkness of melancholy. They called it chase devil for its purported power to drive away evil spirits and the shadows of despair. Herbalists would gather the flowering tops and steep them in olive oil for weeks, until the oil turned a deep, bloody red. This infused oil was then massaged into the skin over areas where the body was believed to process emotions, or taken internally in small, careful doses. They saw this red oil as capturing the very essence of the sun, imparting its warm, vital energy to a patient whose internal light had been extinguished. We now understand that St. John's wort is rich in hyperricin and hyperforin, compounds that act as natural serotonin reuptake inhibitors, very similar to how many modern antidepressant medications work. It is a powerful mood elevator, validating its centuries-old use for lifting the spirits and combating the deep fatigue and sadness of melancholy, when the primary complaint was not a heavy sadness but a restless, agitated mind, a condition they might have linked to an imbalance of vapors rising from the stomach to the brain. They employed powerful sedatives to quiet the nervous turmoil. The queen of these calming herbs was valerian. Its strange, earthy, and not entirely pleasant smell was a small price to pay for its profound effects. The root was dug up, washed, dried, and crushed into a powder to be encapsulated or, more commonly, infused into a strong tea. This brew was a guaranteed passport to sleep, used to calm hysterical fits, ease the tremors of anxiety, and quiet a mind racing with worry. They explained its action by its warm and dry qualities, which were thought to relax tense nerves and dry up the excess moist vapors believed to cause confusion and panic. Today, we know valerian root contains compounds that interact with GABA receptors in the brain, the same system targeted by anti-anxiety medications like benzodiazepines. It effectively slows down the nervous system, promoting calmness and drowsiness. Its use represents a direct, effective intervention for what we would diagnose today as an anxiety disorder or insomnia. The treatment of melancholy often extended beyond simple herbal preparations into a more holistic form of therapy. Herbalists frequently combine their remedies with thoughtful advice on diet, recommending warm, moistening foods like broth-based stews and ripe fruits to counteract the cold, dry nature of black bile. They also emphasize the importance of gentle exercise, fresh air, and engaging in comforting conversations, recognizing that healing the mind required a multifaceted approach. In this, they demonstrated an intuitive grasp of a truth modern medicine continues to reaffirm: that mental well-being is intricately connected to physical health, community, and environment. Theirs was a compassionate practice that sought to heal the whole person, offering plant-based comfort for a suffering that, though explained through a different lens, was every bit as real and agonizing as it is today. While the internal battles against melancholy and fevers were waged with teas and tinctures, the most visible and immediate proof of an herbalist's skill was often written on the skin itself. In an age of coarse woolen garments, infrequent bathing, and constant exposure to the elements, skin ailments were a universal affliction. A simple rash could become a maddening torment, a boil a gateway to systemic infection, and chronic conditions like eczema a lifelong sentence of discomfort and social stigma. For these external miseries, the herbalist's apothecary transformed into a workshop for crafting powerful poultices, soothing salves, and cleansing washes, applying nature's remedies directly to the body's largest organ. One of their most valued allies for a wide range of skin complaints was the cheerful, sun-seeking calendula, often called pot marigold. Its bright orange and yellow petals were considered nothing short of miraculous. Herbalists would gather the flower heads and infuse them gently in warm oils or animal fats, often from a goose or a pig, to create a vibrant golden ointment. This salve was the go-to remedy for everything from angry burns and scalds to chapped, wind-raw skin and the inflamed cracks that could form on hands and heels. They believed the flower's warm, sunny color imparted a drying, heating energy that could draw out infection and stimulate healing. Modern science confirms this intuition. Calendula is packed with flavonoids and triterpenoids, compounds with proven anti-inflammatory, antibacterial, and wound-healing properties. The salve would not only form a protective barrier over broken skin, but also actively reduce swelling and fight off bacteria, making it an incredibly effective all-purpose skin treatment. For weeping wounds or ulcers that refuse to close, they might apply a poultice made directly from the crushed fresh petals, harnessing the plant's full, unprocessed power to encourage granulation and the growth of new tissue. For more acute and painful conditions like boils and abscesses, those deep, pus-filled infections that could render a limb useless with pain, the strategy shifted from soothing to drawing. The goal was to ripen the boil, to bring all the corrupt matter to a head so it could finally burst and release its pressure. The master of this difficult task was the common onion. A slice of onion would be roasted in the embers of a fire until it was soft and warm, then placed directly over the afflicted area and bandaged in place overnight. The herbalist's theory was that the onion's innate heat would help cook and soften the hard core of the abscess. In reality, the compounds released by the heated onion, including potent sulfuric antioxidants, increase blood flow to the area and have a strong drawing effect, helping to localize the infection and pull it toward the surface. A similar, even more powerful drawing poultice was made from the bruised leaves of the common cabbage. These methods, while simple, were often the only things standing between a sufferer and a dangerous, spreading infection that could lead to blood poisoning. Perhaps the most feared skin condition of all was what they collectively termed leprosy. This diagnosis was a catch-all for a terrifying range of disfiguring diseases, from true Hansen's disease to severe psoriasis, lupus, and advanced syphilis. To be declared a leper was a social and spiritual death sentence, resulting in exile from the community and a life of isolation. Herbalists, often operating on the fringes of society themselves, were sometimes the only ones willing to offer help. Their treatments were necessarily aggressive, aimed at halting the progression of what they saw as a deeply corrupting internal poison manifesting on the skin. They might use intensely cleansing washes made from the bitter, astringent bark of the walnut tree, or prescribe internal tonics of sarsaparilla or guaiacum wood, believed to have purifying, sweat-inducing properties that could drive the poison out. While these remedies could not cure true leprosy, for other conditions like psoriasis, the anti-inflammatory and cleansing washes may have provided some relief from the scaling and itching, a small act of compassion in the face of a horrifying illness. Returning to the ever-reliable plantain, its role extended far beyond wound care. For sudden rashes, stings from nettles or insects, and the fiery pain of a burn, the first instinct was to find a plantain leaf. The broad, strongly veined leaf would be crushed between the palms to release its juices and then bound directly onto the affected skin. This impromptu bandage provided instant, cooling relief, reducing inflammation and itching almost on contact. We now know this immediate soothing effect comes from a combination of allantoin, which promotes cell regeneration, and aucubin, a compound with anti-irritant properties. This humble weed, growing underfoot on every well-trodden path, was a living, breathing first aid kit, its virtues understood and deployed by common folk and learned herbalists alike, a testament to the deep, practical connection between people and the healing plants that surrounded them. But for the most profound and unrelenting agony, the kind that accompanied a serious injury, a surgeon's saw, or a terminal disease, the medieval herbalist had a far more potent and far more perilous arsenal. They turned to the most powerful analgesics the natural world could provide, a trio of plants so effective they were known as the soporific sponges and handled with a reverence bordering on fear: opium poppy, mandrake, and henbane. These were not gentle remedies. They were tools for rendering a patient unconscious, for bringing the merciful blanket of oblivion when the pain was simply too much to bear. The undisputed champion of pain relief was the opium poppy. Herbalists would patiently score the unripe seed pods with a special, multi-bladed knife, collecting the thick, white latex that oozed from the wounds. This raw opium was then dried and could be used in a multitude of ways. It might be dissolved in wine to create a potent drink called laudanum, mixed into honey-based syrups for easier swallowing, or even shaped into small pills. When administered, the effects were dramatic and near miraculous. The patient would experience a profound lessening of pain, a wave of euphoria, and finally, a deep, dreamless sleep. This was the closest one could get to modern anesthesia in the 1300s. It allowed for surgeries that would otherwise be impossible to endure and offered a dignified end for those dying in agony. The herbalist understood its dual nature perfectly. They knew the dose that brought relief was perilously close to the dose that would stop a person's breathing. Their careful, experience-based dosing was a life-saving art, balancing on the very edge of toxicity to grant the gift of numbness. For procedures requiring a complete and total insensibility, they might combine opium with even more fearsome plants. Mandrake root, with its often human-like shape, was shrouded in legend. It was said that the root would scream when pulled from the ground, a scream that could kill or drive mad anyone who heard it. Harvesting it was a ritualistic process, involving dogs tied to the plant to pull it free. The root itself contains high levels of scopolamine and atropine, powerful alkaloids that are deliriants in moderate doses but can induce a coma-like state in higher concentrations. A small piece of mandrake root added to a wine mixture would deepen the effects of opium, pushing a patient from sleep into a state of suspended animation. This dangerous cocktail was the go-to method for the most invasive and brutal surgeries, like amputations or trepanning, drilling a hole in the skull. The third member of this potent trio was henbane, a hairy, unpleasant-smelling plant with bell-shaped flowers. Its seeds were particularly rich in tropane alkaloids, similar to those in mandrake. Henbane seeds were sometimes burned on hot coals and the smoke inhaled, or crushed and added to ointments that were rubbed onto the skin. This transdermal application was a clever way to deliver the painkilling compounds directly into the bloodstream, offering localized relief for conditions like gout or deep abscesses. The line between medicine and poison was terrifyingly thin with these plants. The difference between a therapeutic dose and a fatal one could be a single seed, a slightly larger root fragment, or the unique constitution of the patient. An herbalist's reputation was built on their ability to navigate this invisible line, to wield these dangerous tools with enough skill to heal without harming. Beyond these legendary sleep bringers, they had a whole formulary for managing the persistent, grinding pain of chronic conditions like arthritis or gout. For the deep, throbbing ache of inflamed joints, they prepared salves infused with the power of belladonna, also known as deadly nightshade. While its berries were a well-known poison, the leaves contained the same valuable tropane alkaloids. Rubbed onto swollen joints, the salve would be absorbed through the skin, acting as a powerful antispasmodic and pain reliever. They might also turn to the stinging nettle, using a curious technique called urtication, literally whipping the painful joints with a fresh bunch of nettles. The theory was that the intense, distracting irritation and increased blood flow would drive out the deeper arthritic pain. Modern science suggests there may be some anti-inflammatory effect from the formic acid and histamines in the sting, making this painful therapy perhaps slightly more than just a distraction. For toothaches, an exceptionally common and excruciating problem, a more targeted approach was needed. A popular remedy involved the humble clove. Herbalists would take a single clove and have the patient hold it directly against the offending gum. The essential oil in clove eugenol is a natural anesthetic and antiseptic that numbs the nerve endings on contact, providing temporary but profound relief. If cloves were unavailable, they might use a drop of oil from the bitter, blistering wolfsbane plant applied very carefully to the gum, a desperate gamble that traded the pain of the tooth for the risk of poisoning. This vast and sophisticated pharmacopoeia for pain reveals a deep, pragmatic understanding of suffering. They may not have known how these plants worked on a molecular level, but through centuries of trial and observation, they mastered their effects, offering comfort and mercy in a world where pain was a constant and inescapable companion. Moving from the potent analgesics used for deep pain, the medieval herbalist's attention also turned to one of the most delicate and vital senses, sight. In an age of smoky interiors, dusty fields, and limited protection from the elements, eye complaints were a constant source of misery and fear. A simple infection could blur the world, a cataract could plunge a person into a shadowy existence, and an injury could mean a lifetime of blindness. Without any understanding of germs or the intricacies of the eyeball itself, these healers approached vision problems with a combination of meticulous observation and humoral theory, crafting delicate washes and salves that often provided genuine, if unintentional, relief. The most common afflictions were those we might call conjunctivitis, or simple eye strain conditions marked by redness, swelling, a gritty feeling, and a discharge that could crust the eyelids shut overnight. The herbalist saw this as an inflammation, a clear excess of heat and redness in the organ, often blaming an overflow of blood or yellow bile. The treatment, therefore, was to cool, soothe, and gently cleanse. One of their most trusted remedies for this was a gentle eye wash made from the common fennel plant. They would harvest the seeds of this aromatic herb, crush them lightly, and then steep them in cool, clean water, often rainwater collected for its purity. This fennel seed water was then carefully strained through a fine cloth to remove any particles before being used to bathe the irritated eyes. Fennel contains antioxidants and compounds with mild anti-inflammatory properties, and the cool liquid would have provided immediate soothing relief from the burning sensation, while helping to flush out any irritants. They believed the plant's cooling nature was directly combating the heat of the inflammation, a perfect example of their principle of using opposites to restore balance. For more stubborn infections, where the discharge was thick and yellow, a sign of what they might call putrefaction, they would bring in stronger, more astringent herbs. Rue was a favorite, despite its caustic nature. A few leaves would be bruised and infused in water to create a much stronger, bitter wash. Rue is rich in potent alkaloids and volatile oils that have significant antibacterial and anti-parasitic properties. While certainly harsh and potentially irritating to modern sensibilities, this rue wash might have actually been effective against certain bacterial strains causing the infection, helping to clear it up where a gentler remedy like fennel might have failed. They understood its strength, however, and would caution against using it for too long, knowing it could cause its own form of irritation if overused. Another powerful option was an eye wash made from the strained infusion of eyebright, a petite flowering plant whose blossoms remarkably resemble a bloodshot eye. This resemblance, a classic example of the doctrine of signatures, the belief that a plant's appearance hinted at its healing purpose, made it an obvious choice. They would use the entire aerial parts of the plant to make a tea for drinking or a wash for direct application. Modern analysis shows that eyebright contains tannins and other compounds with anti-inflammatory and mildly antibacterial effects, offering a genuine therapeutic action that justified its enduring popularity for centuries. But the most feared eye condition was the gradual clouding of the lens, a cataract. This slow stealing of sight was a terrifying prospect, often attributed to the slow thickening of cold, phlegmatic humors that congealed over the eye's lens, blocking the passage of light and spirit. Herbalists had no way to perform surgery, so their approach was pharmacological, aimed at dissolving this perceived obstruction. Their most startling remedy involved the use of a most unlikely substance, human breast milk. This was believed to be the ultimate temperate fluid, perfectly balanced in heat and moisture, and thus capable of softening and breaking down the cold, dry blockage of the cataract. The treatment was intricate. They would first prepare a strong infusion of the herb fennel, renowned for its benefits to sight. Then, a few drops of breast milk from a healthy woman would be mixed into this fennel water. Finally, this combination was applied as eye drops multiple times a day, for weeks or even months. While this concoction obviously could not reverse a physical cataract, the sterile, soothing nature of the milk mixed with the anti-inflammatory fennel water would have been exceptionally gentle on the eyes. For someone suffering from the dry eye and inflammation that often accompanies aging vision, this regular lavage might have provided significant comfort and improved overall eye health, even if the central cataract remained untouched. It was a remedy born of a profound desire to help, using the most precious and nurturing substance they knew, applied with a hopeful, careful hand. Beyond these prepared washes, the herbalist's role was also one of education and prevention. They would advise on diet, suggesting foods like blueberries and carrots, though they didn't know about beta-carotene or antioxidants. They observed that these foods seemed to support good vision. They understood the importance of rest for eyes strained by fine work like sewing or scribing by candlelight, recommending compresses soaked in cool rosewater to reduce fatigue. In every treatment, from the simplest wash to the most complex milk-based formula, we see the same pattern emerge. Their explanations were rooted in a theory of qualities and humors, but their choices were guided by generations of sharp observation. They consistently gravitated toward plants with actual anti-inflammatory, antibacterial, and soothing properties, creating a practical ophthalmology that offered real comfort and sometimes genuine healing for the suffering eyes of the medieval world. And while a blurred world was a hardship, few pains were as sharp, as maddening, or as inescapable as the agony of a rotten tooth. In the 1300s, dental problems were a universal curse. Diets rich in coarse bread ground down enamel, sugar was a rare luxury for the wealthy that still wreaked havoc, and basic oral hygiene was virtually non-existent. The result was a constant, low-grade symphony of dental misery, where a simple cavity could quickly spiral into a deep abscess, a fever, and even death from a systemic infection. The medieval herbalist, armed with poultices and potions, stood as the last defense against this particular torment, their treatments a fascinating mix of the surprisingly effective and the desperately brutal. The first and most common line of defense was against the pain itself. For the deep, throbbing, relentless ache of a decaying tooth, they had one superstar remedy, the clove. This precious, imported spice was worth its weight in gold for its seemingly magical ability to numb agony. An herbalist would instruct the sufferer to take a single, dried clove and hold it directly against the painful gum, right at the base of the offending tooth. The relief was dramatic and almost immediate. What they couldn't know was that the clove's power comes from a compound called eugenol, a natural anesthetic and antiseptic that numbs nerve endings on contact and fights the bacteria causing the infection. It was a perfect, targeted, and genuinely effective solution for temporary relief. For those who couldn't afford costly imports, a local alternative was peppermint or spearmint. Chewing on the fresh leaves released menthol, which provides a cooling, soothing sensation that can distract from the pain and also has mild antibacterial properties. But numbing the pain was only a temporary fix. The real challenge was dealing with the cause, the infection, and the decay. Herbalists understood the concept of cleansing and tightening the gums. For loose teeth and spongy, bleeding gums, a condition we'd recognize as advanced gingivitis or scurvy, they turned to astringent herbs rich in tannins. These plants cause tissues to contract and tighten. A very common practice was to chew on a twig from an oak or a walnut tree. The bitter, mouth-puckering taste was a direct sign of the tannins at work, which would temporarily firm up the gums and reduce bleeding. They might also prepare a strong mouthwash from the leaves of raspberry or blackberry, boiling them into a potent tea that was then swished vigorously around the mouth. This would have had a similar astringent effect, and the warmth of the tea could provide some comfort to inflamed tissues. For a tooth that was too far gone, where the cavity had reached the nerve and created a pocket of pus, a dental abscess, the strategies became more extreme. The goal was to draw out the corruption. A popular, if painful, method involved a poultice. They might create a paste from the heated root of the iris plant, mixed with a little honey, and pack it against the outside of the cheek over the painful area. The theory was that the drawing power of the root, combined with the antimicrobial honey, would pull the infection out through the jawbone and skin. A more aggressive approach involved the dangerous but potent herb, henbane. The seeds would be burned on a hot coal, and the smoke was carefully inhaled through the mouth. The toxic fumes, rich in sedative alkaloids, were meant to kill the pain and perhaps even the infection within the tooth itself. It was a desperate gamble that risked poisoning for a chance at relief. Ultimately, however, the herbalist's power had strict limits. They could manage pain and fight infection around a tooth, but they could not reverse decay or save a tooth that was crumbling from within. When all else failed, the only permanent solution was removal. This task often fell to the barber surgeon, not the herbalist, but the wise woman would often be called upon to provide the means to endure the ordeal. She might prepare a potent draught of wine, heavily laced with opium poppy syrup or mandrake root, to render the patient as insensible as possible before the terrifying extraction with primitive forceps. Her role in dental health was therefore one of palliation and preparation, easing suffering right up to the edge of a horror that few in the modern world can truly comprehend. But the reach of the herbalist extended even further, into the very core of a person's vitality, what they perceived as the mysteries of the heart and the flow of blood. In the 1300s, the heart was more than a physical organ. It was the seat of courage, emotion, and the very spirit itself. They had no concept of a circulatory system as we understand it today. The heart was not a pump but a furnace, and blood was not a circulating fluid but a volatile, vital humor that could become imbalanced, either too thick and sluggish or too thin and wild. When someone felt a fluttering in their chest, shortness of breath, or a swelling in their limbs, the herbalist saw not a cardiovascular issue but a crisis of spirit and a failure of innate heat, and they turned to a specific class of plants known as cardiotonics to restore this vital balance. One of their most revered heart remedies was hawthorn, a thorny shrub that bursts into clouds of white blossoms each spring before bearing deep red berries, or haws in the autumn. Every part of this plant was used: the leaves, the flowers, and the bright berries. They would gather these haws after the first frost, when they were at their sweetest, and prepare them as a syrup, a wine, or a simple decoction. Patients suffering from what we might now call angina, palpitations, or early-stage congestive heart failure would be given this remedy to strengthen their heart and calm its erratic beating. The herbalist's explanation was beautifully symbolic. They believed the vibrant red berries, the color of blood, were a sign from nature that this plant was meant to treat ailments of the blood and the spirit. They saw it as a warming, drying herb that could fortify the heart's vital force and thin overly thick, congested blood, allowing it to move more freely. Modern science has now fully vindicated this ancient intuition. We know that hawthorn is rich in oligomeric procyanidins and flavonoids, compounds that are vasodilators. They gently widen the coronary arteries, increasing blood flow and oxygen supply to the heart muscle itself. It also has a mild diuretic effect, helping to reduce fluid buildup in the body, which would have alleviated the swelling in the ankles and breathlessness of a failing heart. Their remedy, born of observation and symbolism, was genuinely and effectively treating the symptoms of cardiovascular disease. Alongside hawthorn, the humble garlic was again a cornerstone of their practice, this time for the health of the vessels themselves. They recognized that garlic had a powerful ability to warm the body and stimulate movement. For patients who complained of cold hands and feet, of a general sluggishness and lack of energy, garlic was a go-to prescription. It was consumed raw if the patient could bear it, cooked into foods, or macerated in wine to create a tonic. They believed its intense heat could drive through cold stagnation in the veins, warming the blood and pushing it more forcefully to the extremities. We now understand that the allicin in garlic acts as a mild anticoagulant and helps to lower blood pressure by relaxing the blood vessels. So, while they thought they were heating a cold humor, they were actually improving peripheral circulation and reducing the risk of clots, providing tangible relief for those suffering from poor circulation. Another fascinating remedy for circulatory issues was the use of ginkgo biloba, though this was a knowledge imported from much later trade with the East and would have been an extreme rarity in 1300s Europe, perhaps available only to the most wealthy and connected healers. If an herbalist did get their hands on the distinctive fan-shaped leaves, they would use them to treat memory problems and dizziness in the elderly, conditions they attributed to a cooling of the brain's innate heat and a failure of vital spirit to reach the head. Their theory was that ginkgo could thin the blood and sharpen the mind. Today, ginkgo is famous for its ability to improve microcirculation, particularly the tiny capillaries in the brain, enhancing memory and cognitive function, another stunning example of their practical observations pointing toward a deeper truth they could not yet explain with anatomy. The treatments for what they called dropsy, the profound swelling of the body we now know as edema from advanced heart or kidney failure, show their approach to circulation most clearly. They would employ powerful diuretic herbs like dandelion leaf and nettle, brewing them into strong teas to provoke the kidneys to flush excess fluid from the body. They saw this not as treating the heart, but as correcting a dangerous imbalance of water and phlegm that was drowning the patient from within. By reducing the overall volume of fluid in the body, these diuretics would have lessened the immense workload on a struggling heart, granting a patient precious relief from the feeling of drowning in their own skin. Their entire approach to heart and circulation was a holistic one. They would combine these plant medicines with advice on rest, on consuming strengthening broths, and on avoiding strenuous activity that could overtax the spirit. They were treating the symptom, not the underlying diseased organ, but in doing so with carefully selected plants, they were often providing effective, life-improving care that eased suffering through a combination of tradition, keen observation, and the silent, powerful chemistry of the plant world. Yet perhaps no ailments were more fraught with fear, shame, and desperation than those contracted in the most intimate of circumstances. In the shadows of medieval society, beyond the open treatment of fevers and wounds, lay the hidden world of venereal diseases. These were the secret maladies, conditions so stigmatized they were often whispered about rather than openly discussed, treated in privacy by healers who themselves risked their reputations by offering aid. The most infamous of these, which would later erupt across Europe as the Great Pox or the French disease, we now know as syphilis. But in the 1300s, this particular scourge was only just beginning to emerge, and herbalists faced it with a terrifying combination of aggressive, innovative, and often horrifyingly toxic remedies that reveal the absolute limits of their healing arts. The core theory behind treating these unclean diseases was rooted in the belief that they represented a deep, corrupting poison in the blood, a vile humor that had to be driven out through any means necessary. The most logical weapon, therefore, was the most powerful purgative and cleanser they knew: mercury. Herbalists didn't have pure liquid mercury. Instead, they turned to the few plants that could bioaccumulate this dangerous heavy metal from the soil. The most common source was a group of plants including mercuriales, or mercury herb, and certain fungi. They would harvest these plants, dry them, and grind them into powders to be taken internally or mixed into salves. The treatment was brutal. A patient would be given doses of this mercury-laden preparation, which would trigger a massive, violent physiological reaction. They would salivate uncontrollably, their gums would become sore and bleed, their breath turned foul, and they would suffer from debilitating tremors and stomach cramps. The herbalist interpreted this violent purge as a positive sign. The medicine was working, heating the body intensely and driving the corrupting poison out through the sweat, saliva, and excrement. In reality, they were slowly poisoning the patient, trading the symptoms of syphilis for the often worse symptoms of acute mercury toxicity. It was a desperate gamble that might suppress the visible signs of the disease for a time, but at a devastating cost to the patient's long-term health. For less advanced cases, or for other secret ailments like genital warts or discharges, the approach was slightly less extreme but still harsh. They employed a wide array of intensely cleansing and caustic herbs. The sap of the blood-red euphorbia plant, for instance, was applied directly to sores and chancres. This milky latex is a powerful irritant that would blister the skin, essentially burning away the visible lesion in a painful, corrosive process. Similarly, they might use a poultice made from the leaves of the bryony plant, another severe skin irritant, to try and draw out the corruption from beneath the skin. For internal cleansing, they turned to powerful sudorifics like guaiacum wood. This rare imported hardwood was chipped and boiled for hours to make a bitter, therapeutic tea. The patient would be wrapped in blankets and forced to drink this decoction to induce a profuse, purifying sweat. This wood cure became incredibly popular among the wealthy who could afford the imported timber, and while it did nothing to kill the spirochete bacteria causing syphilis, the regimen of rest, fluid intake, and sweating may have provided some symptomatic relief and a sense of actively fighting the disease. The tragedy of these treatments lies in their agonizing failure rate and the immense suffering they added to an already devastating illness. A patient undergoing mercury treatment might see their skin lesions temporarily improve, only to succumb later to kidney failure, neurological damage, or the loss of their teeth and jawbone, a condition called necrosis, which was a hallmark of mercury poisoning. The line between healer and poisoner became terrifyingly thin in these private, desperate battles. These remedies were not born of malice, but of a medical system pushed to its absolute limit by a disease it could not comprehend, leading practitioners to deploy their most violent tools in a hopeless war against a microscopic enemy, leaving a trail of suffering in their wake. But beyond these intimate and often tragic battles, the medieval herbalist's skill was also tested in the shadowy, high-stakes world of deliberate poison. In a time of political intrigue, blood feuds, and uncertain fortunes, the fear of a doctored drink or a tainted meal was a palpable reality for the wealthy and powerful. This constant threat forged a specialized branch of herbal knowledge, toxicology. The herbalist acting as a poisoner's opponent had to be part detective, part pharmacist, and part magician, developing a fascinating arsenal of antidotes that blended sharp empirical observation with layers of superstitious belief, all in a desperate race against an invisible, fast-acting killer. One of their most effective and scientifically valid tools was something we still use in emergency rooms today: activated charcoal. Without knowing the chemistry behind it, medieval healers understood that certain charred substances possessed a remarkable power to neutralize toxins. Their method was ingenious. They would take common, porous materials like burnt bread crusts, charred animal bones ground into a fine powder, or even specially prepared charcoal from willow or lime wood. This material, with its massively expanded surface area riddled with microscopic pores, was administered as a thick, gritty paste mixed with water or wine. The theory was that this black, unpalatable substance could attract the poisonous venom and hold it fast, preventing it from spreading its corruption through the body's channels. In reality, they had stumbled upon the principle of adsorption. The carbonized material acts like a molecular sponge, binding the toxic particles to its surface and effectively taking them out of circulation in the digestive tract before they can be absorbed into the bloodstream. It was a primitive but profoundly effective form of gastrointestinal decontamination that could mean the difference between life and death for a poisoning victim. For poisons that were believed to have already entered the liver, the organ they saw as the seat of blood and the primary processor of nutrients and toxins, they turned to a plant whose virtue is now a cornerstone of modern herbal medicine: milk thistle. This striking plant, with its glossy green leaves marbled with white veins and topped with sharp purple flowers, was revered for its protective qualities. The seeds were the prized part, carefully harvested and ground into a fine powder to be swallowed or infused into a strong tea. The herbalists believed this plant, with its white, milky sap, a signature they associated with purity and antidotal power, could literally fortify the liver against invasion, creating a shield around the organ that venom could not penetrate. Today, we know that milk thistle seeds contain a complex of flavonolignans collectively known as silymarin. This compound does indeed have remarkable hepatoprotective effects. It stimulates regenerative activity in liver cells and can prevent certain toxins from even binding to and damaging the organ. Their intuitive use of this plant to treat liver damage, whether from poison, alcohol, or infection, was a stunningly accurate pre-scientific discovery. Yet for every empirically sound remedy, there was an equally powerful layer of superstition and symbolic magic. The most famous of these was the belief in the universal antidote, or theriac. This was not a single plant but an incredibly complex, often secret formula that could contain dozens of ingredients, including exotic spices, powdered gemstones, and even bits of dried viper. The inclusion of snake flesh was based on the principle of like cures like, the idea that the venomous animal itself must hold the key to its own poison's antidote. This incredibly expensive concoction was meant to be taken preemptively to build immunity, or immediately after poisoning to counteract its effects, while most of its efficacy was likely placebo, or perhaps due to the inclusion of opium which could ease the victim's suffering. It represents the deep medieval desire for a single, powerful solution to an omnipresent fear. This belief in sympathetic magic extended to the very timing of harvest. It was widely thought that an antidote plant's power was greatest if it was gathered while the herbalist recited specific prayers or under a particular astrological alignment. The root of the peony, for instance, was carved into amulets to be worn around the neck to ward off poison and epilepsy, its power believed to be locked into the shape of the root itself. Other antidotes relied on frightening the poison out of the body. A sudden, loud noise like a gunshot or a slammed door was sometimes employed the moment a poison was suspected, with the belief that the shock would make the venom leap from the body in terror. This intricate web of practice and belief shows us that the medieval herbalist lived in a world where the physical and the spiritual were inextricably linked. A remedy had to be chemically effective, but it also had to be ritually potent, satisfying the deep human need for hope and symbolic order in the face of a malicious and chaotic act. Their antidotes were therefore a perfect reflection of their world, a blend of brilliant, stumbled upon science and the enduring power of the human imagination to fight darkness with whatever tools it had at hand. Yet to view these potent plants as mere chemical compounds would be to miss the very heart of medieval healing. For the herbalist, Every leaf and root was not just a physical substance but a vessel of spirit, a divine gift whose full power could only be unlocked through ritual, prayer, and a sacred alignment with the cosmos. Their craft was a seamless tapestry woven from physical practice and profound spiritual belief, where the gathering of a simple flower was as much a prayer as it was a harvest. This was a world where the lines between pharmacy, faith, and magic were not just blurred, they were non-existent. The process began not in the garden, but in the soul of the healer. Before ever setting out to collect plants, many herbalists would engage in purification rituals. They might fast for a day, abstain from certain foods, or pray for guidance and clarity. The act of harvesting itself was far from a simple mechanical task. It was a ceremonial engagement with nature. They believed a plant gathered in a state of anger, greed, or impurity would lose its virtue, its spirit weakened by the negative energy of the harvester. Approaching a plant required humility and gratitude. There are accounts of practitioners apologizing to the plant for taking its life, even offering a small token like a drop of honey or a precious coin left at the base of its stem as payment to the earth. This deep reverence transformed the act of collection into a partnership, a respectful negotiation between human need and natural provision. The timing of these harvests was not left to chance or convenience. It was meticulously governed by the movements of the heavens, guided by the ancient practice of astrological botany. Every planet, every sign of the zodiac, was believed to hold sway over specific parts of the body, and by extension, the plants that could heal them. The moon's phases were particularly crucial. Roots, drawing power from the hidden underworld, were best dug up during the waning moon, when the celestial energy was pulling inward and downward. Leaves and flowers, reaching for the sun and air, were gathered under the waxing moon, as its growing light amplified their vital virtues. The most potent plants, those used for major ailments, might be collected under a full moon, believed to be brimming with the maximum celestial influence. A plant for the heart, governed by the sun, will be picked at noon on a Sunday. An herb for the brain, under the dominion of the moon, will be harvested on a Monday evening. This intricate celestial calendar was a foundational text for the serious herbalist, a way of aligning their earthly remedies with the divine clockwork of the universe to capture each plant at the absolute peak of its spiritual and medicinal potency. This spiritual dimension shines brightest in the use of certain plants revered not just for their physical properties, but for their perceived magical virtues. Chief among these was verbena, commonly known as vervain. This unassuming plant was nothing short of sacred. It was known as the herb of enchanters, and its gathering was surrounded by elaborate ritual. According to tradition, vervain could only be harvested at the first rising of the dog star, Sirius, and it had to be dug up with an iron tool, iron itself being a metal believed to have power over spirits. The harvester would then use the iron to trace circles in the air around the plant before carefully lifting it from the earth. They had to ensure their shadow did not fall upon the plant during this process, lest its power be stolen away. Vervain was then worn as an amulet to protect against all forms of evil magic, from nightmares to curses. It was placed in cradles to guard infants, hung over doorways to deny entry to evil spirits, and used to purify temples and sacred spaces. Its value was not in any single chemical constituent, but in its perceived role as a universal shield against spiritual corruption, a necessary first defense before any physical healing could even begin. Similarly, we have already seen how St. John's wort was used to combat melancholy, but its power was believed to extend far beyond the mind. Its very name comes from its traditional harvest date on St. John's Day, the 24th of June, near the summer solstice, the peak of the sun's power. The bright yellow flowers, when bruised, release a reddish-purple oil that was seen as symbolic of blood and light, making it a quintessential herb for purging darkness. It was so venerated for its ability to ward off evil that it was often called chase devil. People would hang bundles of it over their windows and doors to create a spiritual barrier against witches and demons, believing that evil could not pass where its shadow fell. Its use was as much about creating a sacred, protected space for healing to occur as it was about administering an internal antidepressant. The plant was a spiritual guardian, its presence a necessary precondition for safety and recovery. Even the most practical of remedies were often accompanied by incantations or prayers. A poultice for a wound might be applied while reciting a specific charm to drive out the poison or the worm of infection. A tea for a feverish child would be stirred with a whispered prayer to the Virgin Mary or a particular saint known for healing. These words were not mere superstition. They were an essential component of the treatment, a way of directing intention and inviting divine grace into the medicinal act. The healer was a conduit, channeling power from the divine through the plant and into the patient. To remove the prayer was to remove the spark that brought the medicine to life. This holistic worldview, where body, mind, and spirit were treated as one inseparable whole, represents a profound depth of understanding that modern medicine is only recently beginning to rediscover. For the medieval herbalist, healing was a sacred covenant between humanity, nature, and the divine, a complex, beautiful ritual where every element, from the position of the stars to the faith in the healer's heart, played its irreplaceable part. And so, as we've journeyed through this world of spiritual rituals and humoral balances, a pressing modern question inevitably arises: did any of this actually work? From our 21st century vantage point, armed with clinical trials and molecular biology, it's tempting to dismiss these ancient practices as pure superstition. But to do so would be a profound mistake. The truth is far more fascinating. While their explanations were rooted in a different reality, medieval herbalists, through millennia of meticulous trial and error, often stumbled upon powerfully effective remedies. They were brilliant natural chemists who simply described their results in the only language they had. Take the beautiful, towering foxglove, with its bell-shaped flowers that seem to ring a silent alarm. This plant was known to the ancients, but it was also feared. They understood that in large doses it was a deadly poison. Yet by the late medieval period, some herbalists began using it cautiously for a very specific condition they called dropsy, the profound swelling of the body caused by what we now know as congestive heart failure. They would prepare a tincture from the dried leaves and administer it in tiny, carefully measured amounts. The results could seem miraculous. A patient struggling to breathe, swollen with fluid, would suddenly begin to urinate profusely. The swelling would subside, and the racing, irregular heartbeat would often slow and strengthen. Their explanation was that the plant's warming, drying qualities were finally overcoming the cold, watery flood drowning the patient from within. The real mechanism, uncovered centuries later, is one of the most important stories in medical history. Foxglove, or Digitalis purpurea, contains powerful compounds called cardiac glycosides, chiefly digoxin and digitoxin. These chemicals work by slowing the heart rate down and, most importantly, increasing the force of each individual heartbeat. This allows a weakened, failing heart to pump blood much more efficiently, which in turn allows the kidneys to finally filter out the excess fluid that is built up in the body. That herbalist, watching the swelling disappear, was witnessing the first successful pharmacological treatment for heart failure. They didn't know how it worked, but their careful observation and precise dosing saved lives, and Digitalis derivatives are still critically important heart medications used by doctors today. Then there is the humble willow tree, a fixture along riverbanks that we've already seen used for fevers. The medieval method of stripping the bark, drying it, and simmering it into a bitter tea was a direct hit on another major medical target: pain and inflammation. Patients with aching joints, headaches, or injuries found genuine relief in that bitter brew. They believed the willow, thriving in cool, damp soil, imparted its cold and moist virtues to cool the hot, dry inflammation of their pain. The reality is that willow bark is a natural repository of salicin. When we ingest salicin, our liver metabolizes it into salicylic acid, the direct chemical precursor to acetylsalicylic acid, which the world knows better as aspirin. This compound is a potent anti-inflammatory, analgesic, and antipyretic. It works by inhibiting the body's production of prostaglandins, the hormone-like substances that cause pain, fever, and swelling. So every time someone in the 1300s drank that willow bark tea to ease their throbbing head or sore back, they were essentially taking a natural, slow-release form of aspirin. Their framework was humoral theory, but the biochemical outcome was real and effective pain relief. The story repeats with the opium poppy, a plant whose power they understood all too well. Their use of its latex to create pain-relieving syrups and sleeping drafts was a direct application of one of nature's most potent analgesics. The active compounds morphine and codeine are opiates that bind to specific receptors in our brain and spinal cord, blocking the transmission of pain signals and inducing a state of euphoria and sedation. Their soporific sponge soaked in a solution of poppy juice was a crude but effective form of general anesthesia. While they explained it as bringing a cold, sleepy quality to combat a hot, painful condition, they were empirically manipulating the human body's own neurochemistry to achieve a desired result. Modern medicine has refined the delivery and dosing, but the core active ingredient remains the same. Even their use of garlic reveals this pattern. They prescribed it for everything from wounds to weak hearts to intestinal worms, citing its powerful heating and drying qualities. We now can identify allicin, the sulfur compound released when garlic is crushed, as a broad-spectrum antimicrobial agent. It can kill bacteria, fungi, and parasites. Rubbing a garlic poultice on a wound would have actively disinfected it. Eating large amounts of garlic could have created an internal environment hostile to intestinal parasites. Its ability to mildly thin the blood and relax blood vessels would have improved circulation, just as they observed. Their classification was symbolic, but their choice of plant was chemically sound. This uncanny effectiveness wasn't luck. It was the result of an enormous, unrecorded, centuries-long clinical trial. Generation after generation of healers observed which plants made people better and which made them worse. They refined preparations and dosages through brutal experience. A recipe that called for a specific number of berries or a precise simmering time wasn't just superstition. It was a hard-won protocol to maximize the beneficial compounds and minimize the toxic ones. They were brilliant naturalists and practical pharmacologists whose language of qualities and humors was simply the packaging for a deep, empirical understanding of plant medicine. They may have believed they were balancing hot and cold, but what they were really doing was administering natural antibiotics, anti-inflammatories, cardiotonics, and analgesics. Their success a testament to the enduring power of the natural world and the keen observational skills of the human mind. But for all their remarkable successes, the world of the medieval herbalist was also a landscape riddled with hidden peril, where some of the most trusted and potent remedies were, in fact, slow-acting poisons or brutal, life-threatening assaults on the body. Driven by a medical theory that sometimes demanded extreme measures to correct extreme imbalances, and armed with plants whose full power they could not yet comprehend, these healers occasionally prescribed treatments that were far more dangerous than the diseases they sought to cure. Nowhere is this terrifying dichotomy more apparent than in their use of heavy metals, where the line between healer and poisoner vanished entirely. The most notorious of these metallic cures was mercury. Known then as quicksilver for its beautiful, silvery liquid flow, this element was the go-to remedy for one of the most feared and stigmatized diseases, the Great Pox, which we now know as syphilis. The logic, from a humoral perspective, was brutally straightforward. Syphilis was seen as a disease of putrefaction and corruption, a foul poison in the blood. Mercury, with its incredible ability to transform shape and induce massive salivation, was believed to be the ultimate purgative. It would heat the body to an extreme degree and literally flush the corrupting poison out through every possible exit. A patient undergoing mercury treatment would be given compounds like mercuric sulfide, or have their body rubbed with mercury ointments, and then placed in a closed box near a fire to inhale the fumes. The results were horrific and predictable. They would salivate uncontrollably, their gums would ulcerate and bleed, their teeth would loosen and fall out, and they would suffer from violent tremors, kidney damage, and severe neurological effects. The herbalist saw this nightmarish purging as a sign the cure was working, driving the disease out. In reality, they were slowly, agonizingly poisoning the patient. Often, the damage from the mercury, including jaw necrosis, where the jawbone literally disintegrates, was worse than the progression of the syphilis itself. It was a desperate, toxic gamble that traded one horrifying disease for another. Alongside mercury, lead was another silent killer lurking in the apothecary's cupboard. Prized for its sweet taste and its ability to create smooth, heavy ointments and pigments, lead was a common ingredient in many preparations. Lead oxide was used in plasters to treat sores and ulcers, and lead carbonate was a key component in many cosmetic powders. Most insidiously, lead was used to sweeten and preserve cheap wine, a practice that may have affected entire communities. The symptoms of chronic lead poisoning, abdominal pain now known as lead colic, paralysis, gout, and mental confusion, were often misdiagnosed as other ailments, leading to even more treatments that might have contained yet more lead. A patient complaining of digestive troubles might be given a lead-based tonic, inadvertently sealing their fate with every dose. The healer, seeing the sweet taste soothe a patient's stomach initially, would have believed they were successful, completely unaware they were administering a cumulative neurotoxin that would lead to irreversible damage and a painful death. The plant kingdom, too, offered its own array of botanical landmines, plants so potent that the difference between medicine and murder was a matter of a few drops or grains. The beautiful, dark purple berries of the deadly nightshade, or Atropa belladonna, were a classic example. The name itself speaks volumes, bella donna meaning beautiful lady, because women used diluted drops of the berry's juice to dilate their pupils, believing it made them more attractive. Herbalists, however, used it for its powerful antispasmodic and pain-relieving properties. In infinitesimally small doses, the alkaloids atropine and scopolamine could ease gut cramps or, as we saw, be applied in salves for joint pain. But the margin for error was vanishingly small. Just a few berries could contain a fatal dose, causing delirium, rapid heartbeat, convulsions, and death. Its use required a knowledge so precise, so handed down through careful apprenticeship, that any mistake could be catastrophic. Even more feared was monkshood, also known as wolfsbane or aconite. This striking plant with its hooded, blue-purple flowers is one of the most toxic plants in the world. Medieval herbalists knew its power all too well. The root was sometimes used in tiny, carefully measured amounts as a potent painkiller for conditions like gout or neuralgia, applied topically in a poultice. They believed its intense heating quality could burn through the cold, damp humors causing joint pain. But the active toxin, aconitine, is a potent neurotoxin and cardiotoxin that absorbs easily through the skin. A healer preparing the poultice could themselves be poisoned by handling the root. For a patient, even a slight error in preparation could lead to a terrifying death characterized by numbness, vomiting, a crashing heartbeat, and paralysis. It was the definition of a high-stakes remedy, a dance with death where the price of a misstep was the patient's life. Perhaps the most tragic aspect of these deadly cures is that they were almost always administered with the best of intentions. The herbalist, operating within the confines of their understanding, reached for the most powerful tools they believed could work. When faced with a disease as horrifying as advanced syphilis, a gentle willow bark tea was useless. They believed only a weapon of equivalent violence like mercury could possibly prevail. Their fundamental error was a misunderstanding of the enemy. They were fighting a bacterial infection with a heavy metal poison, and the body was the devastating battlefield where these two forces clashed. These dangerous and deadly cures stand as a stark reminder that knowledge, without full understanding, can be a double-edged sword, capable of bringing forth both life-saving relief and unimaginable suffering. Now, this entire world of humors and herbal treatments wasn't a single, unified system practiced identically from castle to cottage. The knowledge of a healer in an English village would have been vastly different from that of a practitioner in the bustling markets of Cairo or the sun-drenched monasteries of Sicily. Herbal medicine in the 1300s was a vibrant tapestry of regional traditions, each thread colored by local plants, cultural beliefs, and the complex flow of knowledge between the Christian West and the Islamic world. Geography was destiny, determining which roots, leaves, and flowers were available, while trade routes and translated texts acted as the nervous system, carrying revolutionary ideas across continents. In the damp, verdant forests of northern Europe, an herbalist's practice was deeply rooted in the native flora that thrived in the cool, wet climate. Their pharmacopoeia was one of hardy trees, marsh plants, and hardy shrubs. The oak, with its immense cultural significance, provided not only astringent bark but also galls, those strange growths caused by wasps which were crushed and used as a powerful styptic to stop bleeding. They relied heavily on plants like yarrow, plantain, and nettles that sprouted along every path and field. The monastic gardens of England, France, and Germany became crucial repositories for this local knowledge, but they also served as living libraries for plants introduced by the Romans centuries earlier. Rosemary, lavender, and sage, though Mediterranean in origin, were lovingly cultivated behind stone walls for their culinary and medicinal virtues. Here, the prevailing medical theory was a slightly muddled version of the ancient Greek texts, primarily filtered through the work of early Christian writers. Diagnosis and treatment were often interwoven with folk charms and prayers to local saints, creating a unique blend of practical botany and deep faith that characterized Northern European herbalism. A remedy for a wart might involve applying the milky sap of a dandelion stem while reciting a specific verse, the physical and spiritual treatments working in tandem. Venture south to the sun-baked coasts of the Mediterranean, and the herbal landscape transforms dramatically. Here, the influence of the Islamic world, or Al-Andalus as it was known in Iberia, was nothing short of revolutionary. While Europe was struggling through the early Middle Ages, Islamic scholars in centers like Baghdad, Cordoba, and Damascus were actively preserving, translating, and most importantly expanding upon the medical knowledge of the Greeks, Persians, and Indians. They weren't just copyists, they were brilliant innovators. Figures like Avicenna, whose monumental canon of medicine became a foundational text for centuries, and Al-Razi, a master clinician, systematically tested and refined herbal knowledge. Their methods of distillation, which we touched on earlier, were far more advanced than those in the north, allowing them to create incredibly pure and potent essential oils and alcoholic tinctures, a technological leap in herbal preparation. This sophisticated knowledge didn't stay locked away. Through the vibrant trade networks of the Mediterranean and the cultural exchanges in places like Sicily and Toledo in Spain, this advanced Islamic science slowly filtered into Christian Europe. A European herbalist might now have access to treatments using exotic spices like cinnamon, clove, and black pepper, imported from the East through Muslim traders. They could read Latin translations of Arabic texts that describe the use of senna for constipation or camphor for cooling fevers, plants that were entirely new to them. The Mediterranean herbalist, therefore, often had a far more cosmopolitan arsenal, blending local plants like olives, figs, and grapes with these expensive, imported wonders. This exchange wasn't a one-way street. The Islamic world enthusiastically adopted and integrated plants from every culture it encountered. The Persian physician Ibn Sina wrote extensively on the medical uses of materials from India and China. Herbs native to Europe, like the humble henbane, found their way into Arabic formularies, but the real genius of the Islamic tradition was its systematic and empirical approach. They established strict standards for the identification and preparation of herbs, and they pioneered the concept of controlled clinical testing. A remedy wasn't just accepted because an ancient text said so. Its effects were observed and recorded with meticulous care. This created a body of herbal knowledge that was incredibly detailed and effective. So, a patient seeking treatment in 13th century Cordoba might receive a remedy that was a complex formula of a local Spanish plant, a spice from the Moluccas, a distillation technique from Persia, and a diagnostic method from Greece, all synthesized through the rigorous lens of Islamic science. This cross-pollination of ideas created a golden age of herbal medicine in the region, a sophistication that European practitioners would spend the next few centuries trying to catch up to. Beyond these two major spheres, countless other regional traditions flourished, often in isolation. In the Scandinavian north, healers relied on robust plants that could survive the long winters: angelica for digestion and protection against evil, cloudberries rich in vitamin C to ward off scurvy, and chaga fungus harvested from birch trees to brew a tea believed to promote overall vitality. In the Slavic regions of Eastern Europe, knowledge was deeply intertwined with pre-Christian pagan beliefs and a different set of native plants, like the adaptogenic rhodiola rosea, used to increase stamina and resilience to stress. These local practices were often dismissed as mere superstition by the learned physicians of the South, but they represented a deep, granular understanding of the specific environment and its challenges. The regional variation in herbalism wasn't just a matter of different plants. It was a reflection of how culture, climate, and commerce shaped the very definition of health and the means to achieve it, creating a rich, global conversation of healing that was far more complex and interconnected than we often imagine. But to truly understand the source of their power, we must step out of the smoky apothecary and into the light, walking alongside the herbalist into their true workshop, the garden and the wild, untamed land beyond. This was not a hobbyist's plot of dirt. It was a living library, a sacred pharmacy, and a direct link to the divine, cultivated and foraged with a reverence we have almost entirely lost today. The medieval herb garden was a world in miniature, meticulously organized not just for convenience, but according to a deep, symbolic logic. At the heart of a monastery's physic garden, or within the walls of a wealthy estate's enclosure, you would find a very specific layout. Often, it was designed in a circular or square shape, divided into quadrants by two paths that crossed at the center, forming a cross. This wasn't just for easy access. It was a reflection of the cosmos itself, a microcosm of the ordered universe with the four directions representing the four humors, the four elements, and the four seasons. Each plant had its assigned place in this sacred geometry. In one quadrant, you might find the hot and dry herbs rosemary, thyme, pepper aligned with the direction of the sun and the element of fire. In another, the cold and moist plants like lettuce, cucumber, and violets would be grouped together, connected to the element of water and the moon. Beyond these formal, walled gardens lay the vast, uncharted territory of wild crafting, the art of foraging for medicine in meadows, forests, and marshes. This was where the herbalist's deep, intimate knowledge of the local landscape became their greatest asset. They knew to seek out valerian not in the open field, but in the damp shade along a riverbank. They understood that the most potent yarrow, soldier's woundwort, would be found not in rich, soft soil, but in hard, compacted earth along ancient footpaths, as if the plant drew its strength from hardship. This wasn't random gathering. It was a targeted harvest based on a profound understanding of ecology that we would now call plant symbiosis. They knew that certain trees hosted specific mushrooms with their own healing properties, and that the best time to harvest dandelion root for liver ailments was in the autumn, when the plant's energy had retreated downward, concentrating its virtues in the taproot. This connection to place was absolute. An herbalist's reputation could hinge on their secret patch of especially potent henbane or a secluded elderberry bush that produced exceptionally large clusters of fruit. This knowledge was a form of wealth, often passed down as a closely guarded secret within families or from master to apprentice. The act of harvest itself was a ritual steeped in ceremony and astrological belief. The herbalist did not simply yank a plant from the ground at any convenient moment. They consulted intricate lunar calendars and astrological charts, believing that the celestial bodies exerted a direct influence on the vital spirit, or virtue, contained within each leaf, root, and flower. The moon's phase was paramount. Roots, which drew their power from the hidden, subterranean world, were always dug during the waning moon. As the moon's light diminished in the sky, the plant's energy was believed to be pulling downward into its base, making the root at its most potent. Conversely, leaves and flowers were gathered during the waxing moon, as the growing lunar light was thought to amplify the aerial parts of the plant, filling them with vibrant, healing energy. The most powerful plants, those used for life and death remedies, were often harvested under the full moon, at the very peak of its celestial power. The day of the week and the ruling planet also played a crucial role. An herb governed by the sun, like the bright-eyed St. John's wort, would be picked at noon on a Sunday. A plant under the dominion of Venus, such as the heart-shaped lady's mantle, might be gathered on a Friday. This complex system ensured the healer was not just collecting a physical substance, but capturing a plant at the absolute peak of its spiritual and medicinal potency, aligning the remedy with the harmonious movement of the universe itself. Before the first cut of the iron knife or the first pull of the hand, the herbalist would engage in a moment of spiritual preparation. They might fast or pray to ensure their own spirit was pure and their intention was clear, for they believed a plant gathered in a state of anger or greed would lose its virtue. Approaching the plant required humility. There are accounts of practitioners first asking the plant's permission to take its life, even offering a small token of payment, a drop of honey, a precious coin, or a strand of hair, left at the base of the stem as an offering to the earth spirit. For the most sacred and powerful plants, the ritual was even more elaborate. To harvest the mysterious mandrake root, feared for its deadly scream when pulled from the earth, the herbalist would use a trained dog. They would tie the dog to the plant, then move a safe distance away and make a loud noise, causing the dog to lunge forward and pull the root free, tragically absorbing the deadly curse meant for the human harvester. Even for common plants, the tools mattered. A bronze or iron knife might be used for certain herbs, while others had to be plucked by hand to avoid the corrupting influence of metal. This entire process, from the astrological timing to the whispered prayer, transformed the act of harvest from a simple agricultural task into a sacred covenant between the healer, the plant, and the cosmos, infusing every subsequent remedy with a power that was believed to be far greater than the sum of its chemical parts. Yet within this complex world of healing, a deep and consequential divide was forming, one that would shape medicine for centuries to come. This was not a conflict of science versus superstition, but rather a clash of two entirely different systems of authority, education, and legitimacy. On one side stood the university-trained physician, a figure of immense social prestige. On the other was the practical healer, the herbalist, the wise woman, the barber-surgeon whose authority came not from a degree, but from observed results and generational trust. Their relationship was fraught with tension, suspicion, and class prejudice, and it created a starkly tiered system of medical care that largely depended on your wealth and social standing. The university physician was a rare and elite figure, educated for years at institutions like those in Bologna, Montpellier, or Paris. His training was almost entirely theoretical, based on the revered texts of ancient authorities like Galen and Avicenna. He learned medicine not by examining patients or grinding herbs, but through intense study of Latin texts, complex disputations, and the intricate logic of humoral theory. He was a master of deduction, not experimentation. His value lay in his ability to reason, to analyze a patient's urine in a specially shaped glass flask, to take their pulse, and to deliver a learned diagnosis based on the balance of their humors. This rarefied education made him incredibly expensive, placing his services firmly in the realm of kings, nobles, and the highest ranks of the clergy. He saw his role as a scholarly one, above the messy, manual work of actually preparing medicines. That menial task was left to an apothecary, who would follow the physician's written prescription. It was from this lofty position that the physician often looked down with disdain upon the folk healer. To him, the herbalist was an illiterate rustic, a superstitious old woman, a dangerous quack who operated outside the sanctioned bounds of learned medicine. He dismissed their knowledge as mere old wives' tales, uncontrolled folklore that had not been refined and systematized by the rigorous logic of the university. The fact that these healers often used the local vernacular instead of Latin, and learned their craft through hands-on apprenticeship rather than from ancient books, only reinforced the physician's view of them as uneducated and illegitimate. This professional contempt was often codified into law. As the 14th century progressed, guilds of physicians began to form, lobbying for the power to license practitioners and to prosecute those who practiced without their approval, a clear attempt to create a monopoly on healing and to marginalize their competition. But for the vast majority of people, the peasants, the artisans, the urban poor, the university physician was an utterly irrelevant figure. His fees were astronomical, his language was incomprehensible, and his presence was unlikely to ever be seen in their village or their cramped city tenement. Their entire medical world revolved around the local healer. This was the wise woman who had helped their mother through childbirth, the herbalist who had successfully treated their father's fever with a willow bark tea, the barber who could pull a tooth and stitch a wound. This healer spoke their language, understood their struggles, and charged what they could afford, often accepting payment in eggs, cloth, or a day's labor. Their knowledge, while dismissed by the physicians as folklore, was in fact a vast, practical, and empirically tested repository of information. They knew which plants reduced a fever, which poultices drew infection from a wound, and which herbs could ease the pain of childbirth. They were the first and last line of defense for 90% of the population. This created a fascinating and often contradictory reality. A wealthy nobleman suffering from a fever might be bled by a physician to balance his humors, following a complex astrological chart to determine the optimal vein to open. Meanwhile, his serfs, suffering from the same fever, would be treated by a local woman with a cold infusion of elderflower and mint. It is entirely possible that the serfs had a better chance of recovery. The physician's theories, while intellectually elegant, were often completely wrong and sometimes actively harmful, like the overuse of bloodletting, which could weaken a patient further. The herbalist's remedies, while explained through a different framework of sympathetic magic or humoral opposites, often contained genuine, active compounds that modern science confirms are effective. The tension between these two worlds was therefore not just about social class. It was a fundamental conflict over the source of authority. Was true knowledge found in the pages of an ancient book, or was it found in the observed results of hands-on experience? For the people of the 1400s, the answer was a matter of life, death, and everyday survival. This remarkable journey through the world of medieval herbalism isn't just a history lesson. It's a story with a direct and powerful impact on the medicine we use today. The intuitive, observation-based work of those 1300s healers has become a fertile hunting ground for modern pharmaceutical companies, who are now turning back to these ancient texts and traditions in a desperate search for new compounds. We're witnessing a fascinating full-circle moment, where cutting-edge science is validating the hard-won knowledge of the past. The development of aspirin is the most famous example. For centuries, herbalists used willow bark tea to treat pain and fever. They explained it as the plant's cool, moist qualities combating a patient's hot, dry imbalance. In the 1800s, chemists isolated the key active ingredient, salicin, and eventually synthesized acetylsalicylic acid, creating the world's most ubiquitous over-the-counter drug. The medieval explanation was metaphorical, but the biochemical effect was precisely accurate. This process of rediscovery is more active now than ever before. In labs around the world, researchers practice what's called ethnobotany, the scientific study of the relationships between people and plants. They are actively poring over medieval manuscripts, like the leech books of Anglo-Saxon England or the extensive writings of Hildegard von Bingen, treating them not as historical curiosities, but as data sets for potential new drug leads. The logic is brilliant and straightforward. If a plant was consistently used across centuries and continents to treat a specific ailment, there's a high statistical probability that it contains a bioactive compound that actually works. This approach shortcuts the random, expensive process of testing tens of thousands of synthetic compounds, instead focusing on plants with a proven, if anecdotal, track record of efficacy. For instance, the purple foxglove, which medieval herbalists cautiously used to treat dropsy or severe swelling, gave us digoxin, a life-saving heart medication that is still critically important in managing congestive heart failure and arrhythmias today. Their careful, dose-dependent use of this powerful plant directly informed one of modern cardiology's cornerstone treatments. Perhaps the most exciting frontier is the fight against antibiotic resistance. As our modern antibiotics become less effective, scientists are urgently searching for new weapons. They're returning to ancient wound remedies, testing the antimicrobial properties of plants like garlic, honey, and even the mold from bread, a precursor to penicillin that was sometimes applied to wounds long before Alexander Fleming's famous discovery. A groundbreaking study examined a 1,000-year-old Anglo-Saxon recipe for a eye salve from Bald's Leech Book, which called for garlic, onion, wine, and ox gall to be brewed in a brass vessel. To everyone's astonishment, this ancient concoction proved lethally effective against modern-day methicillin-resistant Staphylococcus aureus, or MRSA, a notorious superbug that plagues hospitals. The combination of ingredients and the chemical reaction with the copper ions from the brass pot created a potent cocktail that breached the bacteria's defensive biofilms. This isn't just a historical footnote. It's an active, promising line of research that could yield entirely new classes of antibiotics inspired by a formula that is over 1,000 years old. The legacy extends beyond single molecules to entire concepts of healing. The medieval focus on using gentle, demulcent herbs like marshmallow and plantain to soothe inflamed mucous membranes is the direct ancestor of our modern cough syrups and throat lozenges. Their use of carminative herbs like ginger and fennel to settle an upset stomach is perfectly aligned with today's understanding of how these plants ease gastrointestinal spasms and bloating. Even the holistic approach of the wise woman treating the patient's diet, environment, and mental state alongside their physical symptoms is experiencing a massive resurgence in the form of integrative and functional medicine. We are rediscovering, with the help of clinical trials, that their intuition about treating the whole person, not just the disease, leads to better long-term health outcomes. The sophisticated herbal knowledge of the medieval period was never truly lost. It was simply waiting for our science to advance enough to understand its genius, allowing us to separate the profound biological wisdom from the symbolic language used to describe it, and in doing so, opening up a new old path to healing. And so we reach the end of our journey through the shadowed forests and smoky apothecaries of the 1400s, a world where healing was a profound and perilous art. What emerges from the mist is not a simple story of primitive superstition, but a far more complex and fascinating tapestry. Medieval herbalism was a breathtaking, and often terrifying, blend of genuine effectiveness, profound spiritual belief, and dangerously misguided theory. They wielded plants like willow bark and foxglove with stunning precision, their hands guided by generations of observation to create remedies that genuinely saved lives and eased suffering, even if their minds explained it as balancing hot and cold. Yet these same hands could also administer mercury and deadly nightshade, their actions guided by a medical model that could turn a healer into an accidental poisoner. For them, there was no separation between the physical and the spiritual. A prayer was as vital a component of a poultice as the plant itself, and the phases of the moon were as important to a harvest as the sharpness of the knife. When we look back from our world of MRI machines and mRNA vaccines, the gulf seems almost unimaginable. We have replaced the four humors with a deep understanding of cellular biology, swapped astrological charts for randomized controlled trials, and traded the mortar and pestle for automated pharmaceutical production. We have conquered diseases that were death sentences for them and extended our lifespans beyond their wildest dreams. The progress is nothing short of miraculous. Yet in our rush to celebrate how far we've come, we might also pause to consider what we may have left behind. They viewed the patient as a whole, body, mind, and spirit existing within a living, breathing cosmos. Their medicine, for all its errors, was deeply personal, holistic, and intimately connected to the natural world. Our medicine is powerful and precise, but it can sometimes feel impersonal, fragmented, and isolated from that ancient, intuitive connection to nature's pharmacy. This leads us to a final, humbling thought. If we could bring a 1400s herbalist into a modern operating room or pharmacy, they would undoubtedly view our technology as pure magic. But what would they make of our theories? They would be utterly baffled by our concepts of viruses, neurotransmitters, and antibiotics. It forces us to ask, what are the fundamental truths we hold to be self-evident in medicine today that future generations will look back on with that same mixture of pity and astonishment? What practices that we consider cutting-edge and rational will be seen by our descendants as the equivalent of balancing black bile or purging with mercury? The story of medieval herbalism is ultimately a lesson in humility. It reminds us that medical knowledge is not a static destination, but a constantly evolving journey. It teaches us to respect the wisdom of the past, even when it is wrapped in the language of superstition, and to approach the miracles of the present with the sobering awareness that our own certainty might one day look very different in the light of a new dawn.